All right, welcome back, class. We're back in the Mad Medic's office here. So we're gonna kick it off today, and we're gonna talk about a topic that's actually kind of tough. But there's a couple things I'm gonna definitely be very specific on because National Registry loves to throw this one into your integrated how to hospital experience, and so this is talking about toxicology and substance abuse. And I want to stress on this lecture again a couple of key points. The key point number one is that no matter what, um, you're not going to know every toxicology. You're not going to know every antidote to everything. I think that if, matter of fact, if you run up on a paramedic that says that they know all of that, you should run the other direction in a rapid and quick manner. It's kind of like the guy that knows everything about hazmat. If they know everything about toxicology, be scared, okay? Because I know a lot of smart guys out there that, and the first thing that they will tell you, and these are toxicologists, very specific. And matter of fact, our medical director at Shands that was his thing. Is he was very big into toxicology, and the very first thing that he would say to you is you don't know toxicology really, but what we are going to learn about is how to identify the toxidromes, how to identify the syndromes. And identification of these are so very important that we understand exactly what it is that we're doing this. And so the biggest thing is it's the study of any toxicology is the study of toxins, which are drugs or poisons, and the antidotes and their effects of the antidotes on how it works. Okay, and so you can get it a lot of ways if you really stop and think about it. We can eat it, we can inhale it, we can have it injected into us, we can absorb it in our skin. We can so there's a lot of ways to get this. So poisoning is usually describes a it usually describes the non-pharmacological substances versus an overdose is when you're dealing with some sort of medication, whether it's accidental or intentional. Okay, now your again, there's 4 million poisonings occur annually, and I'd say probably that number has gone up a little bit more. And 10% of emergency department visits and EMS responses involve some sort of toxic exposure, and 50% of accidental poisonings occur in children under the age of 6. Yeah, I would say it's probably one of the bigger calls that we get. And one other thing is again, one of the resources that we use with this is poison control, and poison control is an absolute must. Okay, matter of fact, a lot of times, guys, poison control can actually monitor the patient at home where we don't have to transport them. And actually, that is if they say, hey, look, we can take care of this, we can monitor at the house via the phone. Again, and again, we can keep them there for a couple hours. And the big one is they drank bleach. Okay, and truth be known, if they ingest a little bit of bleach, they'll probably get a little bit of diarrhea. Nothing really bad, especially the household bleach. We're not talking about the more concentrated stuff. So again, they have the ability to monitor these patients via telephone for a lot of the common emergencies. And if they tell you, yeah, you need to take them to the hospital, poison control says that, guess what? Load up, let's ride. Okay, because you definitely need to do that, and they will actually contact the hospital and say, "Hey, yeah, this is what the patient took. Here's the stuff. Here's the antidote." They'll actually fax that stuff ahead. So it actually, and if you've ever been involved in one of those cases, it's actually really cool to sit there and watch it. Again, if a child experienced an accidental ingestion, there's a good chance, 1 out of 4, similar ingestion within 1 year. Yeah, I guess you don't learn. 80% of all suicides involves a drug overdose. Okay, and again, so when we're dealing with drug overdoses, we really need to find out, hey, why did you take all this stuff? Serious poisons, especially in children older than 5 years of age, can be intentional by parents or caregivers. Yeah, there's some sick people out there in the world that cause them to do that, okay? Now, again, here's some big problem here. Let's think about this. This is usually underneath everybody's sink. And and I can tell you right now that mine probably looks like that. But look at this. Look at all the stuff that's under there. The ant killer, usually an organophosphate poison. Again, the cleaners. Again, and these kids don't know any different. So they're gonna put it in their little mouths because they have to taste it. And then the good news is most of this stuff is really bitter and they spit it right out. But there are some stuff that they don't do that. But again, if they get a certain degree in them, again, can be a definite problem. So one of the things you really do need to, especially when you're doing public education of these folks, is say, hey, if you got little kids, you might want to do this. Put your chemicals someplace where that won't happen. Again, if they tear a whole bunch of Ziploc baggies out, not a big deal. If they drink the Amdro, yeah, probably going to be a bad day for everybody. Okay? So again, 90% of hospital admissions for toxic exposures, and usually 95% of fatalities occur in this category when you have an adult poisoning or an overdose. And most of these, by the way, are intentional. So some great numbers there. And again, 1-800-222-1222. Yes, that's right. I have that number memorized. I would highly recommend that you memorize it. Again, this is usually it's based out of a major medical center or teaching hospital. The one that Poison Control that they connect you to here in Florida, the one that I just spurted out, that would be, it's a national center actually. And again, they have experts there on call, toxicologists, like the real deal. Okay. So again, and then they can help you immediately determine. They can help actually if you give them a description of the pill. Like if they have a medicine or the description of the bottle, they're actually able to tell with the very limited information, they can actually give you and tell you the things to start doing in the field for that patient. Now, the way we get toxically exposed, again, there's four portals of entry. Again, ingestion, inhalation, surface absorption, or injection. And then toxic substances have both immediate and delayed effects. So keep that in mind. Just because I was exposed to it, I feel okay now, doesn't mean 30 minutes from now that the problem's going to be worse. So again, all these common things are exposures for toxic entries. And again, ingestion is in when you can involve burns to the lips, tongues, throat, esophagus, and then you can have delayed effects from that as it absorbs into the GI tract. Your inhalations is usually the good news is this is usually pretty quick. It irritates pulmonary passages, which again causes swelling, which can cause additional problems later down the line. And then the problem is the gases or vapors can get in there and actually get mixed with the water and become actually caustic. So that is one of the and I'll give you the perfect example of that. Mix ammonia and bleach together, add it to your lung tissue. Yeah, really bad things. So again, the things you can inhale, again, this is just a small list. I will tell you from personal experience, Freon will set you on your butt. It's an asphyxiant. Again, cyanide, pretty quick. Again, this is what they usually use in the in your death chambers, is they put cyanide and it aerosolizes the cyanide. Okay. Again, you can have these are actually created for a reason: tear gas, mustard gas, nitrous oxide. Yes, actually, we use that as a treatment. So again, it's a very nice painkiller, by the way. So yes, you're actually giving them toxic exposure by giving them nitrous oxide. Okay. So surface absorption. Again, they can get through the skin or the mucosal membranes. Again, your organophosphates, these guys are usually used as pesticides. Matter of fact, that's kind of what we worry about, like a melathion spray. So the guy's out there crop dusting, you're out in the field, you get crop dusted, next thing you know, all of a sudden you're walking around, peeing yourself, pooping yourself, salivating all over yourself. Don't forget about like contact things like poison ivy, poison oak. Again, these are things that usually the powder gets on you. The best thing you can do is wash this stuff off first and foremost. Again, your injections, again, these are usually, it's shot in there. You can have delayed or systemic reactions. Usually this is some sort of bite, whether it's snake bite, spider bite, something of that nature, stings, insect stings. And again, there are insects that can sting and bite the class, the Hymenoptera, which is your honeybees, your hornets, your yellow jackets. These are the guys that actually leave the stingers in there. Some scorpions, by the way, that it has a very again, the smaller the scorpion, actually, the worse the toxin is. The problem is that the bigger scorpions have more venom, so that's why they kind of do a little bit more damage. Let's not forget about our marine buddies, along with the snakes, which is your jellyfishes, your stingrays, and we'll have some fun when we get to that little section right there. Okay. Matter of fact, one of the good Dr. Abo, if you ever get to talk to him up at Shands, got the real long curly hair, really cool guy, but that's his kind of thing is the marine animal toxicology, and he goes out on, like, Shark Week. He'll go out with them on the boats in order to be their medical care with that. So how are we going to deal with these toxicological emergencies? The first and foremost is, again, make sure the scene is safe. Make sure the scene is safe. I'm going to say that again. Make sure the scene is safe. Again, patients who are suicidal, just remember, if they're going to kill themselves, they have zero problems usually killing you. Again, if they are intoxicated, they're going to probably act stupid. Again, look for signs of overdoses, empty pill bottles. Don't forget, if it's a snake bite call, animal bite call. My favorite one is the honeybees that turned over on the interstate. Again, you got all these honeybees out there. Well, they will tear you up. So again, they're going to keep your scene safety in mind. If it's a hazmat emergency, remember that it can quickly incapacitate you. Hey, what's that green cloud we just went through? Hey, the engine just shut off. Oh, I'm not feeling good. Thunk, dead. Okay, so again, scene safety, really big thing here. So find out how many patients we do have, assess their mental status, okay? Again, ABCs, again, make sure that we get the ABCs, because we don't know what the toxin is, what the toxin actually did. And when the patient's mental status changes, we absolutely have to go back to those ABCs, make sure, because again, the toxin, hey, I'm doing fine, hey, I'm doing fine, poop, kicks in, dead. Okay, so again, it might be just a simple respiratory toxin where it knocks off the nervous system control of the lungs. So again, bagging them through that might be the treatment of choice for these patients. Okay, again, proceed to your physical exam, get a full set of vital signs, and with your unresponsive, treat it like a trauma, basically head to toe exam. Again, make sure you take a look at it, make sure you don't see any type, if they're unconscious, what caused them to be unconscious? Did they hurt themselves going unconscious? Okay? And relay any type of information that you do find to poison control. Never delay supportive measures or immediate transport. I want to stress that one, kind of big one. Ongoing assessments, this is what you're going to have to do. Again, and guys, if we don't know what it did to them, I would say every 5 minutes is a very thing. Again, if this is the kid that might have drank a little bit of bleach, but they're worried about caustic burns to the mouth, then they want them transported. Again, that's an airway problem as far as I'm concerned. We continue to assess those. We have to keep watching them. You might have the occasional thing, well, I took 4 Tylenol. Okay. Again, it depends on what exactly is going on with the patient. But again, I would say you're probably going to have to do every 5 minutes on these guys. Getting deconned. Again, hazmat situation, if they've absorbed it, this reduces the intake. And by the way, a majority of decon is done, especially like with a hazmat or an absorption issue, simply by taking the clothes off and washing. Okay? You would be surprised how it does that. And again, it enhances the elimination of toxin as well. Again, and you might actually see they might actually enemize the patient in order to get the whole bowel irrigation in order to help eliminate the toxins from that. Remember, our colon it's one of the things it does. An antidote, again, is a substance that will neutralize a specific toxin or counteract its effects. And I'll give you a perfect example. Sodium bicarb minimizes tricyclic antidepressant overdoses. Hint, hint, hint. We're going to talk about that a lot later. Okay? Again, specific actions is dictated by your medical direction, calling poison control, call poison control again. Again, usually your med director is probably going to say call poison control. Okay, so again, but your local guidelines can help out with just that. All right, your suicidal patient. I was just kidding, guys. Take it serious. All right. You may be charged with patient abandonment if, again, and this is where it falls into a huge, big, gigantic gray area. Bring your friends. Let the police officers talk to them. Let the social workers talk to them. Let yourself talk to them along with a couple of other people. Again, this is not, and if anything, if they were just kidding, let them go through a 72-hour process one time to unkid them, to remind them not to do such a thing. Okay, but don't leave them there. You remember, you got to remember about protective custody laws in our state. Again, it's a Marchman Act. Again, have police law enforcement actually involve them early. Okay, and again, we cannot place them into that. The physicians can, but I will tell you that it gets a little bit on the dicey side, okay? So again, involve a lot of people. This is a good time to pass your bag of poo. This is definitely the time to do it. Now, ingested toxins, we're going to go dive a little bit into these guys before we get to this to our first break here. The ingested toxin, guys, is you need to find out what it is that they took, okay? The type, the quantity, the time, okay? Time distance shielding, well, this definitely falls into that category, okay? Whether the patient took any alcohol or anything that might potentiate the substance. Again, if they took a barbiturate and then they drank a bunch of alcohol, you can pretty much guarantee some unconsciousness coming. Okay, so again, drug habits are used, especially if they're an abuser already, and any type of underlying medical illnesses or injuries. What did they ingest? When did you ingest it? How much did you take? Did you have any alcohol? All these questions are great questions. Have you ever seen a counselor before? Okay, that's a really good question. And what is your weight? Again, somebody my size can take 4 Tylenol and it's not a big deal. Somebody, let's say Dolly size, for those of you that don't know Dolly, they're really tiny, small. Again, but if they're 40 kilograms soaking wet, again, the 4 Tylenol can cause a little bit of problems. Okay, again, I think that is a very important thing. You gotta estimate that correctly, and again, ask them how much they weigh. I know you're not supposed to, but yeah, actually you are supposed to. Okay, there's cool ways to do it. Again, provide physical evidence of the intoxication, and again, find any underlying issues that may account for the symptoms. Okay, so remember, your physical exam can help do that along with your questioning. Okay, a perfect example is if they ingested narcotics. Again, pupils, pinpoint. And again, how do we, the impaired or blurring vision is the mouth. Does it have any burns on it where they've eaten anything? Weird odors from that. Okay, any vomitus with that? Again. Do we have some problems? Are they wheezing because of that? Again, these are ingested toxins, but they can still be allergic if they've eaten peanuts, for example. Again, are we having a systemic reaction or anaphylaxis from that? Again, your abdomen, again, is poisoned by salicylates or methyl alcohol. Again, caustics or botulism toxin can cause severe cramping in those areas, and you can actually get the movement of the abdomen through that. So again, do a good physical exam, okay? And if the signs and symptoms are inconsistent with a single diagnosis, remember, if they took one thing, could they have taken 2, 3, 4, 5 things? And can those things work against each other or produce a combination of symptoms? And you can have that happen, okay? So again, ABCs. Can't stress that one enough. And by the way, in poisoning situations, RSI actually might be required, okay? Nasotracheal intubation, if they've still got a gag reflex, no, that's why we have drugs. Again, nasotrach is kind of like they're unresponsive back in the day when we didn't have the ability to kill the gag reflex, okay? Again, provide supplemental oxygen if the patient's hypoxic. IVs are good. The coma cocktail, by the way, Thiamine, D50, and Narcan. That would be a version of the coma cocktail. Yeah, stay away from it, really, unless they've actually taken the drug, and we know that that's the antidote. Don't give them the antidote. Don't give them it just prophylactically. You don't want to, hit everybody with calcium and bicarb because that's a toxic. No, it doesn't work like that, guys. You can actually make things worse with that. All right. D50 until determination of the glucose. Again, we talked about that in the coma cocktail. But if you got narcotics, again, 1 to 2 milligrams of Narcan. My favorite statement that I loved hearing back in the day is that, we used to push Narcan like it was candy. We really, well, I hate to say it, we still are, but for a whole different reason. Pretty much anybody overdosed, they got 2 milligrams of Narcan. That only fixes narcotic overdoses, okay? Naloxone only fixes the narcotics. So just because you're giving it, no. So if you're suspecting a narcotic, in other words, you get there, the pupils are all whacked out, your pinpoint, and and again, you got respiratory depression. Yeah, okay, it's probably good. Oh yeah, the bottle of hydrocodone that are laying there on the side. Oh, okay, probably a good idea to do that. All right, we're going to hold up here. We'll get back started on the for the ingested poisons on the next one, and I'll see you then.